you for joining us this evening. Thank you for being here and tuning in. My name is Dr. Michael Ruzek. I serve, I have the privilege of serving as the medical director of the emergency department of the Capitol Health ED located on the Browns Mills campus at the Deborah Heart and Lung Center. Now, at Capitol Health, we have three emergency departments where we care for patients in our communities. One is here on the Browns Mills campus at Deborah Heart and Lung. The second Capitol Health Emergency Department is located in Trenton, New Jersey at Capitol Health Regional Medical Center. And the third emergency department where we care for patients is located at our Capitol Health Hopewell campus, located in Pennington, New Jersey. Again, my name is Michael Ruzek, and it's my pleasure to be with you this evening, and it is my pleasure to care for patients here on our Browns Mills campus and serve as the medical director of the emergency department. Now, the topic that we're going to discuss today is when to go to the emergency department versus when to make a doctor's appointment. We know that these are unprecedented times, and, our communities are really concerned about the COVID pandemic. And our perspective and our outlook is it is our job and responsibility to keep our communities healthy and safe before COVID, and we will continue to do that throughout COVID and after COVID. If anything, it's during these times that we hear our calling as clinicians louder than ever. And thank you for tuning in this evening to hear some of the topics that we're going to discuss. And I hope the information that's shared with you is helpful. And the goal of sharing this information is to make you, our community, well informed and to make the best decisions for your health possible and the health of your families. Now, the things that we're going to discuss today, I'm going to go ahead and give a brief synopsis of the topic, and then I'm going to go ahead and answer some of the questions. There were some questions submitted ahead of time, which I'll be happy to go through, and we'll do that right after I give a brief synopsis of today's topic. We're going to try to keep things brief and get straight to the point because I know your time is valuable, and thank you for being with us. Now, the topic of when to go to the emergency department versus when to make a doctor's appointment is a topic that comes up often. And one thing I like to share with my patients is if you're ever in doubt, ask. Our emergency departments are open 24/7. We're here to serve you around the clock, 365 days a year. And if you ever have a question, feel free to ask us. Feel free to call your doctor's office and ask. It's always better to ask than to assume. One thing that I was always taught in my training is I'll share some, tidbits of information, and I hope you use it and it's helpful. Is vital signs are vital. So if you are an individual at home questioning whether or not to go to the emergency department and how to come about that decision, first of all, I'll say this: no one knows themselves better than the patient. So if you even questioned it, or if you questioned your health, or you have any lingering questions, it's always better to err on the side of caution. So, making the statement that vital signs are vital, what could you do at home right now to really help with the screening process? So, I'm going to share with you three items I keep in my cabinet. One is a blood pressure cuff machine. The technology's improved on these, and these have gotten much better. Two, a pulse ox. And three, this is a thermometer to check your temperature. So with these three items, if you ever notice you go to an emergency department or a doctor's office, one of the very first thing they do is they take your vitals. So I recommend that that's something that you keep in your cabinet at home. I know I keep it in mine. And if your health was ever in question, or the health of your loved ones was ever in question, you go ahead and you screen if they have a temperature. More importantly, in the age of COVID, you screen their oxygenation. Here on the pulse ox, you're able to get a pretty accurate read of the oxygenation of yourself or your family member and their heart rate. And you check their blood pressure. And these devices have gotten more accurate throughout throughout the years. Now, that being said, this is a screening tool, and these tools aren't always perfect. One thing that we were always taught as clinicians is always treat the patient, not the number. So even if all these vital signs, which are the cornerstone of medicine, are normal, and you don't feel well as a patient, I recommend you still come in and you be seen by a clinician. Because, again, more importantly than these numbers are you, the patient, and how you feel. And in my opinion, no one knows themselves better than you. You live in your body, you know how you usually feel at your baseline, and no one knows themselves better than you. Now, in terms of outpatient visits and outpatient doctors' offices, just because there's COVID, doctors did not stop seeing patients. So if you have a question of, is your clinician, your physician still seeing patients, simply pick up the phone and call them. That leads me to my next topic. Some patients have said, hey, Dr. Ruzek, I've delayed my care. I'm afraid of going into healthcare settings because I'm afraid of contracting COVID. Now, that is a legitimate concern. And thank you to the patients that have asked that question. Whether it's in an emergency department or an outpatient setting, rest assured this. As clinicians, we do not want our patients to contract COVID in the clinical setting, and we've done everything possible to prevent that. Let me share with you some of the steps that we've taken here at Capital Health to ensure every patient that comes through our doors or goes to our outpatient centers or doctor's offices is well cared for in a safe environment without risk of contraction of COVID. Some of these tests include temperature screening for every patient that comes through the door, negative pressure rooms that we have designated in COVID areas for any patients that are under suspicion of having COVID-19 or any viral symptoms, masking of every patient that comes through this door, including our staff and our healthcare workers, and deep cleaning and sanitation of every room that's been used that had a suspected patient that might have had viral syndrome. So these are all tests that I want you to be rest assured that we've taken to make sure that our patients are cared for in a safe environment without contracting any viral symptoms or disease. That being said, I share with my patient this sentiment always. I've read that after COVID has been declared as a national emergency in all emergency departments throughout the country, the rate of patients coming into the ED to be seen for heart attacks dropped by 23%. The rate of patients coming into emergency departments to be seen for stroke dropped by 20%. And these are numbers throughout the country in the 10 weeks following COVID being declared a national emergency. And finally, the rate of patients coming into emergency departments to be seen for hyperglycemic events dropped by 10%. So what does that tell me? I look at these numbers and I say to myself, patients probably didn't just stop having heart attacks, strokes, hyperglycemic events, but unfortunately, due to the fear of contraction of COVID, a lot of patients delayed their care. So what are we seeing in the emergency departments throughout the country? Most emergency departments throughout the country will share with you that the volume of patients has unfortunately decreased due to patients' fear of coming in and being seen and contracting COVID. But on the flip side, the acuity has increased. So we are seeing patients a lot sicker and a lot later in their disease progression. So, my advice to patients is this, and I've had patients ask me this all the time. Dr. Ruzek, is it safe to be seen at your doctor's office or your emergency department if, if I'm not feeling well? Can I just, stay home and see if it gets better? And that's a fair question, okay? And that's a fair concern. And I thank my patients for asking these questions. Now, what I share with my patients is I say, let's keep things in perspective. Have you ever been to a supermarket this past week? Have you went shopping this past week? Have you been at any gathering in this past few weeks? And usually the answer is yes. They've been to a local supermarket, they've picked up household items, and it's great that our supermarkets are asking people to wear masks, but they're not doing a tenth of the screening and the precautions that we're doing in our hospitals. So from my perspective, if you're comfortable going out shopping, going to a supermarket, going to events, then the emergency department and the clinical setting is that much more safe. So if you're comfortable with one, I say you should be comfortable with the other. You know, Most places, public places, don't test the temperature of everybody that walks through the door. They don't have negative pressure capabilities. They don't separate people with viral symptoms from people that don't have viral symptoms. And they don't do the amount of deep cleaning and sanitation that we do here at the hospital. So, in the reality is, hospitals are some of the safest places to be because of all these steps and measures. And that being said, my advice to patients is one of the things that you could do to set you up for success more so than any other intervention is early intervention in your care. So, if you were to have stroke like symptoms, cardiac symptoms, infectious symptoms, the best thing that you could do is treat that stroke early, treat that heart attack early, treat that infection early, because the earlier you have that intervention, that clinical intervention, the more likely you are to have a successful outcome. So, if you thought about it, you thought about it for a reason. And my best advice to you to set you up for success is early intervention. So, I always use the example that if my own father is sitting down in the living room at home with me and goes, Mike, I have a little pressure on my chest. You're a doctor, Mike. Am I having a heart attack and what should I do? My response to my own father would be, Dad, yes, I'm a physician, but here at home, I don't have the tools to properly assess whether or not you're having a cardiac event. And even if you were, neither do I have the tools to treat you here in the house. So, my best advice to my own father would be to go immediately to the emergency room if he had any symptoms, whether it be chest pain, shoulder pain, pain radiating to the jaw, chest pressure, difficulty catching your breath, and the list goes on and on. Indigestion. So, if you had any of those symptoms and thought whether or not you were experiencing a cardiac event, I would even recommend to my own father that you need to immediately be seen in the emergency department, because you think about it, you have the risk of having a serious cardiac event and losing cardiac tissue, which is very hard to recover back, versus the risk of contracting COVID, on the other hand. Well, the risk of contracting COVID, given all the interventions and all the safety measures that we have in place, is almost nil compared to the risk of having a cardiac event for anyone having one of the symptoms I experienced. I just shared with you, especially if you have comorbidities and risk factors and family history. So, those are all things to keep in mind. And really, the goal of today's program is to educate you, our community, because it is our obligation as clinicians to care for you and keep our communities safe and healthy. And what would break my heart more than anything else, and break the heart of all the clinicians around me, is seeing patients deny themselves the care that they deserve and that they need out of risk or out of fear of taking the risk of contracting COVID. So, that being said, I just wanted to share that with you. That doesn't mean you don't go about your life and with the care and the caution that a lot of us have been doing, meaning masking, washing your hands, taking the best sanitary precautions and hygiene precautions and the social distancing. You know, people ask me, what do you believe is the best way to defeat this pandemic? And my response to individuals is there's no single way, there's no magic bullet. We're all in this together. A cornerstone is going to be prevention. And it's really great that a lot of individuals are taking the steps to mask, social distance, wash their hands, and really taking the steps to prevent spreading the virus. But, I want you to also be optimistic that we have some of the top care, some of the top antivirals, some of the top treatments, the vaccines coming down along the pipeline, and this is going to be a multi-pronged approach. But for patients that are home, I want you to know that you're not in this alone. We're in this together, and it is our privilege as clinicians and physicians and healthcare workers to care for you. And thank you for allowing us that opportunity to care for you. I'm going to go ahead and share with you some other stories and questions that some of our patients have shared with us, and I hope it's helpful. One patient asked, what's the difference between going to an emergency department and an outpatient office or an urgent care? Well, you know, if you have a non urgent condition, for example, a cellulitis that hasn't progressed, it's okay to go see your doctor's office. But if you say, I'm not going to go to the doctor's office and I'm going to leave this cellulitis to progress, it could turn into a bad enough infection where it'll require IV antibiotics, it'll require admission. At worst case scenario, it might progress to a condition called sepsis, which is a systemic infection where the bacteria get in the bloodstream. Those are all things that you want to avoid. And the outpatient setting is appropriate for a number of conditions. But when conditions are life threatening or sick or require admission, then going to the emergency room is the right intervention. Another question is, I was supposed to get my knee replaced last spring, but couldn't because of the pandemic. Do you recommend I go ahead and schedule that procedure? Well, that's a great question. My answer to that is you should have an honest conversation with your surgeon. Because guess what? The interventions that I shared with you that we're doing here in the emergency department, we're doing in our outpatient offices, we're doing in our outpatient surgical centers, we're doing in our inpatient setting. We're taking every intervention to make sure your risk is minimized or almost nil. So trust me when I say your surgeon doesn't want you to have the infection, your outpatient physician doesn't want you to contract COVID, and they've taken steps to make sure that you are social distant when you present to their office, that the right sanitary conditions are there to prevent you from contracting that infection. So if it is a matter of delaying care and getting the care you need versus a matter of the fear of contracting COVID, I think it's worth having that conversation with your surgeon or your outpatient physician. The other thing a question I get is about visitor restrictions. So, in terms of visitor restrictions, We abide by CDC regulations and regulations from the Department of Health. These are always ever changing. So if there were any visitor restrictions, please never be offended, because if we do it, we know how challenging it is, but we do it just really for the safety and to minimize any spread of virus. So we are abiding by CDC and the Department of Health recommendations, really for the safety and the care of our patients. Um, so keep that in mind. You could always call ahead of time and ask questions in reference to visitation policy, and I recommend you do that. And just keep in mind, if there are any restrictions in reference to visitation policy, it's because that is another added layer that we take in order to make sure every single patient that comes through our door is safe. Some patients say, okay, Dr. Ruzek, that's great. You've taken all these interventions to minimize the spread of disease and COVID within the clinical setting in the emergency department. What if I get admitted? Am I still safe? And the answer is yes. Because here at Capitol Health, every patient that gets admitted, we test them for COVID, and patients that are tested for positive are separated from the patient population that tested negative. So even in that setting, if you were to be admitted, know that you are going to be appropriately admitted. You are going to be placed in a setting which is safe for you. You are going to get the care you need, and there's going to be a minimal risk for you. So that's a very fair question. I'm glad that a patient took the time out to ask that question, because it's important to make sure our patients' minds are at ease. And I get it. This is a very stressful time, but the goal of this presentation is to make sure that our patients' minds are put at ease and really deliver the message that you are not in this alone, and all of us in healthcare are here with you. Last but certainly not least, I want to take a moment to really recognize the true heroes and the selflessness of the individuals in healthcare. And when I say individuals in healthcare, I don't only mean physicians and nurses. The list goes on. It's our physicians, our nurses, our PAs and NPs, our technicians, environmental services, our security personnel, our registration personnel, our food services. All of us are in this together, and all of us are members of our communities. So when we care for patients, we're just not caring for another individual, we're caring for another member of our community. We do it with pride. We look forward to doing it each and every day. And I couldn't be prouder of my colleagues. And I couldn't thank them enough for the tremendous job that they've done throughout this pandemic. We went through the first season of COVID, and now we're experiencing an uprise in the second season of COVID. And we're going to do a great job, and we're going to get through this together. This is a community approach. We're here for our patients. It's these very moments that we signed up for. This is the very reason that myself and colleagues of mine went into healthcare. It's for the privilege of caring for patients at their most vulnerable moments, at the moments where they need us most as clinicians, and that's what we're here for. And I thank you, our patients, for giving us that trust, for giving us that privilege to care for you. And again, we're here for you. You're not alone. And if you ever had a question, a doubt, it's always better to err on the side of caution. We're here to serve you. And the reality on the ground in our emergency departments is much different than what you're seeing in TVs. Our waiting rooms, we do our best to keep them empty at all times. We pull patients to the rooms. We screen them. We keep all our rooms sanitary at all times and sterilized. We mask all our patients and our staff, and we have interventions put in to make sure not only you get the best care possible, it's the best care possible in the safest environment possible. I hope that this has been as helpful for you that as I intended it to be. Thank you for tuning in. I wish you and your loved ones a happy and healthy fall and winter season. Spring is coming down the road. We will get through this together, and we're here to care for you any day, anytime, 24/7, 365 days a year. And please don't hesitate to reach out and come to our facilities, and we wish you the best of health. Thank you so much. I'm Dr. Michael Ruzek, and it has been my pleasure to share this evening with you. Good health to you and all your families. Good night.